like to call the Senate Veterans and Military Affairs Finance and Policy will come to order. It is Thursday, January 7th today. It is 8:33 a.m. And I'd just like to, first of all, again, appreciate everybody coming in on these type of circumstances in this strange situation that we're doing nowadays. I'd like to start off. There's a script that we're going to read and just how we're going to process through the Zoom finance or the Zoom committee hearings from this point on. So I'll read through it and then we'll go from there. So I want to thank everybody who is joining us today. There's a new committee process for many people at the state of Minnesota Senate. So I'll ask committee members for patience as I, the chair, do try to conduct this remote hearing. We might encounter some glitches, but we'll do the best to smooth things out as along the way we go. So I do appreciate that. Before we start, I'd like all members to know that this is an official hearing and it is being recorded. I'd also like to remind members to mute yourself when you are not called to speak on. When it's your turn to speak, you can unmute yourself. If you would like to speak, either use the raise your hand feature, or you can text myself or Megan as well, or Dave. There is a bottom at the bottom of the screen. So if a list starts to build, I will announce that list out as we go. And then so at least you have an idea who we're going to be speaking. I'd like to do the Pledge of Allegiance, but we're going to probably forego it for the time being, as well as trying to pound a gavel on the desk in my office would probably be more annoying than anything. So we're going to forego the Pledge of Allegiance. With that being said, we do have a few new members and a couple of us that have been around for a couple of years. And I would like to we'd start out with introductions, both by the members of the committee and some of the agencies that we've worked with for many years here. So list of committee members, again, I'll start with myself. My name is Andrew Lang. I am in my second term as a Minnesota Senator. I was first elected in 2016. I represent a small portion of southwestern Minnesota. It's 4 counties. It's 80,000 individuals. It's a state of our portion of the state I grew up in, and I've represented now for, this will be my 5th session. I am a full-time helicopter pilot. I fly for North Memorial Air Care. I fly there full-time as much as possible, and during session, not so much full-time, but I am also a member of the Minnesota Army National Guard. I'm in my, what would it be now, 19th year of service. I have, as Major General Mankey knows, I've also been a part of the aviation side of the Army. I went to flight school, 16 years ago already. I've kind of ran the gamut in the Guard. I've been deployed a couple of different times, both times to Iraq. I was supposed to stay in Kuwait, sir, and I ended up going to Iraq again for a significant amount of time, but it was okay. It was a great experience. I enjoy very much being in the Minnesota Guard. There's nothing I regret about doing it, and I'm sure proud of the service I've done, and I'm proud of all the individuals I'm glad that we have a bunch of veterans on this committee that can share their experiences and share their thoughts and as we move forward through the process. So with that being said, I am ready to move on. So I think Senator Anderson, your name starts with A, so I think you're next on the list if you'd like to go through it.
Well, the last name starts with A. I don't know about the first name. Although I could use, there's names been given to me with the first letter A, so I could be considered A too. But anyway, I'm Senator Bruce Anderson. I represent Wright County, Senate District 29, first elected in 2012 to the Minnesota State Senate, and previously was part of the Minnesota State House of Representatives, and was there for about 18 years. I was a former member of the U.S. Air Force Reserve down at Fort Snelling. That was there for 6 years. Prior to that, I was in the Minnesota Air National Guard for 20, and previous service was with the U.S. Navy for 6 years. And so I had a little bit of background in the military area. Presently retired from both the Guard and the Reserve, and Vice Chair of the Minnesota Senate Veterans and Military Affairs Committee. Look forward to the experience, even though this is a little different in way of meeting and doing things, but I think we can get through it, and I hope that we can accomplish many different issues that come before us, and I look forward to what we have not only today, but in the days to come. So thanks for the opportunity to share.
Thank you, Senator Anderson. Senator Newton, you were the ranking minority member and probably one of the most experienced military guys we have. Well, I think Senator Howell, maybe you guys can fight it out, but Senator Newton.
Well, Howell and I will have to arm wrestle over this. I'm Senator Jerry Newton. I represent District 37, which is Coon Rapids, Blaine, Spring Lake Park. I had 23 years of active military service, including 17 years deployed overseas, with one of those years in Vietnam and 7 in the Middle East. So I've traveled around quite a bit. I have been on the Veterans Committee, either in the House or the Senate, since 2009. And I'll keep it brief. I just look forward to working with all of you again, and look forward to a successful session. Thank you.
Thank you, Senator Newton. And our newest member in the committee, Senator Zach Duckworth.
Well, good morning, everybody, and thanks for being here. It's fun to see a lot of current or former Red Bulls on the call. My name is Zach Duckworth. I'm from District 58, which is Lakeville, Farmington, and Southern Dakota County. I'm also a current member of the Minnesota Army National Guard. Been a member for about 15 years. Currently the executive officer of 2 of the 136, Go Bearcats, and spent some time overseas with Senator Howell's son, who's also a member of the Guard. And I'll leave it at that. Thanks.
Thank you, Senator Duckworth. Senator Howell, or her, excuse me. Her's next on the list. Senator Her.
Okay, thank you, everybody. Nice to meet everyone this morning. Senator Fong Her, and I want to also welcome Senator Duckworth. For those who little uncertain how to pronounce my name, is like Fong Her is my full name, and I represent East Side St. Paul, pretty much east of I-35 all the way to Maplewood. So Senator Wigger is on the north of me, and Senator Kent is on the east of me, and then downtown, as you know, in the Capitol Center, Sandy Pappas, west of me, and south is Cottage Grove. I'm a son of Special Guerrilla Unit veterans from Laos. That's during the Vietnam War, and I'm a small business owner. I produce video and also do outreach consultant for a living for the last 20 years. Pretty much the most part I live in the state of Minnesota. And yeah, so I enjoy, being in this committee, and enjoy also a trip to Camp Bibley, whenever we take a trip up there and know and hear about the soldiers' life experience. So thank you for being in this committee together. And thank you also our lead member, DFL, who encouraged me to be in this committee. Thank you.
Thank you, Senator Her. Senator Howell, next on the list.
Thank you. So my name is Jeff Howell. I represent the District 13 that wraps around St. Cloud. I've served in the Navy for 3 years with a deployment to the Iranian hostage crisis, which kind of dates me. And then then 35 years, or just about 35 years in the Guard, with a couple of deployments to Iraq. I've got a son currently serving in the Horn of Africa. And then I've got 2 other sons that both served. One went to Afghanistan and now lives does not serve anymore. He was a Red Bull, now lives in Florida. And my youngest son is also serving as a Red Bull. My daughter decided nobody was going to tell her when and how to run, so she didn't join. But she has thought about it. But it is good to be back on this committee. I served 3 terms in the House. With 2 of those, I was on the Vets Committee, so it's good to be back on the Vets Committee. I've been in the Senate since 2018, so it's good to be here and look forward to working on veterans issues.
Senator Uyghur?
Good morning. Had to unmute myself. I'm Chuck Uyghur from Maplewood, District 43. It includes 7 communities: North St. Paul, Maplewood, Oakdale, Mdva, White Bear, Birchwood, Willerny. I have several very active organizations, the VFW and the Legion. The schools have outstanding ROTC program, and I am just so happy to be back on this committee again. My father came back partially disabled from World War II, and I learned all about service to country and sacrifice growing up, and through relatives. I would have served myself. I have asthma, and so that would have made it impossible in boot camp. So otherwise, I have a daughter that had been a Red Bull, served in Iraq, and came back, now works for the VA as a social worker. And I have almost daily conversations with her, working with the vets and programs, and then especially their families. And then when they come back as a very high priority. And just finally, I want to do a shout out for the Minnesota Assistance Council for Veterans in North St. Paul, next to our Veterans Memorial Park. They just completed a home for homeless vets to stay. And there are so many wonderful things done. And I know I probably overextended the introduction, but I am so thankful I can serve and look forward to whatever I can do to help in our mission. Thank you.
Thank you, Senator Uyghur. I'd like to go through a couple of all the staff members. Senate Counsel Joan, are you on still? I think I saw her name. There it is. Good morning.
Good morning, senators and staff. My name is Joan White. I'm from the Office of Senate Counsel. And my role is if you need bills drafted or amendments done, I can help you with that. I just started staffing this committee last session, so my tenure is short. If I can't answer any questions, I will make sure I get back to you with an answer. And I'm looking forward to a great session.
Thanks, Joan. Fiscal Analyst, Andrew Erickson. Andy, are you on?
Yes, thank you, Mr. Chair. I'm Andrew Erickson. I'm also with the Office of Senate Counsel Research and Fiscal Analysis. I'm the fiscal analyst for the committee. If you have questions about the budget, about getting fiscal notes for bills that involve potential expenditures or savings, or any questions about that, feel free to reach out to me. You'll probably see me a couple times presenting spreadsheets. This is who I am. Thank you.
Thank you. Next on the list, Committee Administrator Dave Razon, and he's kind of the right-hand committee guy. So go ahead, Dave. Tell him what you do.
Thank you, Mr. Chair. My name's Dave Razon, and this is my 14th session with the Minnesota Senate. First 9 sessions, I was a legislative assistant for 4 different senators. In the last 4 sessions, I've been the committee administrator for this committee and the local government committee. So looking forward to another great session, Mr. Chair. Thank you.
Thanks, Dave. Committee legislative assistant, and this is also my LA, Megan Hennon, and she is going to be moving on to better things than working for me. So let her introduce herself, tell a little bit about it.
Yeah, I am just temporarily filling in. I am Megan Hennon. I have been Senator Lang's LA for the last 2 sessions, I believe. Came from the House, and I will be Senator Ingebrigtsen and Senator Eichhorn's committee administrator for environment, finance, and mining policy.
Thanks, Megan. The Republican researcher, John Cotter, looks like he's on as well.
Good morning, members. John Cotter. This will be my 5th session with the Senate, 3 years as a legislative assistant for Senator Kerry Rood, and then my 2nd year done in research, and looking forward to helping the committee out.
Thanks, John. DFL researcher Christopher Morgan. Christopher, are you on? There he is.
I am. Good morning. My name's Chris Morgan. I'm the DFL staff member who will be handling this committee. And prior to this, I was Senator Eric Simonson's LA for the last 3 years.
Thanks, Chris. Okay, moving on from that, I appreciate all the information. And if, as we go through, maybe we can do sort of the same thing with some of the agency heads and General Mankey as well. Now that we have completed introductions, we have 2 department presentations on our agenda today. The first of which will come from the Minnesota Department of Veterans Affairs. We have with us today Commissioner Larry Herke, Legislative Director Ben Johnson, and a few other staff members that I think I've been seeing pop up that I think they're going to give us a good little presentation. So, sir, go ahead with your presentation.
Thank you, Chair Lang. Thank you, committee members. It's great to be with you today. I'm coming to you today from Sauk Center, Minnesota, and we do not have high-speed internet here in Sauk Center, Minnesota. So if I start breaking up, you'll have to tell me, and I'll cut the video, and we'll just cut just to voice. But while Ben Johnson is bringing up the slides here, I just share a little bit about myself as a point of introduction. Served a total of 30 years in the military. Of that, about 12 years on active duty, both active duty with the U.S. Army and then active duty as part of the Minnesota National Guard. Several positions throughout my time with the Guard. Enjoyed time as battalion commander, of course, and I think I'm probably one of the few people that have actually commanded a troop, cavalry troop, a artillery battery, and also an infantry company. So I'm pretty proud of being a little bit well-rounded there as far as the military background. Did deploy with the Red Bulls, and good to see all the Red Bulls here on this call-in today. Had an opportunity to go to Iraq and support deploying as a mobilization officer for the Department of Military Affairs of the National Guard, deploying over 10,000 soldiers in support of OEF and OIF. My last posting with the Guard was as the facilities manager for the armories throughout the state. Learned a lot about taking care of facilities and what you should do and shouldn't do in that area. After retiring from the Guard, in 2016, I worked for the Department of Administration as the Director of the Enterprise Sustainability and established that position. Got to do that for about 2.5 years before I was asked by Governor Walz to take the position here as the Commissioner for Veterans Affairs. Love the position. It's a wonderful job and really really an important position as we go forward. I'm going to have my key leaders introduce themselves as they present their parts of the presentation here. So you'll hear that in just a moment, but I'll go through a couple slides to begin with. Ben, if we can go to the next slide. Our mission statement is to serve Minnesota veterans, their dependents, and survivors, and we connect them with both state and federal care. This is an important part because a lot of our veterans can be difficult, especially on the federal side, to be able to get all the benefits that they've earned, and we help assist with that. And our vision is, of course, to come up with programs that are going to maximize quality of life for our veterans. Just as a point of reference, this year we're looking at about 312,000 veterans in the state of Minnesota, and that number continues to go down as we have more veterans from World War II and Korea that are leaving us every year. Next slide, Ben. This is sort of an agenda of the areas that we'll cover. There's a small map there. Although it shows, I think, 9 different icons on there with our major locations. I can tell you that through our outreach programs, we're actually in about 55 different locations pre-COVID. And a lot of that's, when I say locations, that's one person in an office or location at least one day per week. And so we do have a statewide coverage for veterans throughout Minnesota. Next slide, Ben. This is the team I have. I basically have 3 major functional areas. My program and services, Brad Lindsay, in the area of central staff. Mike McElhenney is the leader there, and it's a very small staff for an agency that he's responsible for, but they got great output. And then my largest area is in the area of veterans healthcare, and that's Douglas Hughes. And each one of them will be introducing themselves here momentarily. And at this point, I'm going to give it over to Chief of Staff Mike McElhenney.
Thank you, Commissioner. Good morning, Mr. Chair and committee members. Just a brief introduction. I think I've met most of you. I served 21 years in the active duty myself. Was wounded early on in 2001 with Hamid Karzai and some of that early insurgency. At which point I came to Minnesota. Mayo Clinic actually brought us up here. My wife. I was able to serve with probably the best battalion and the 34th ID, and that was the second of the 135. So a little bias there. But I started working with the agency in 2010. I started off in the communications department. I worked in the legislative arena for a while. I was the director doing Ben Johnson's job for about 5 years, and also am the current chief of staff for the agency. And as the commissioner said, the central staff's function is essentially to support our 2 main divisions, which healthcare programs and services you'll hear about. And there's about in the neighborhood of 54 to 58 staff within all those areas: legal, finance, programs. Various other areas within that. But what you're seeing here, Mr. Chair and committee members, is the agency's strategic plan. One of my functions is to synchronize efforts within the agency to ensure that we're meeting the governor's intent, the legislature's intent, the agency's statutory requirements. And recently, we've created a new strategic plan with 4 major goals, and you can see those on the slide. Support the continuum of support that addresses all the needs of veterans, both those of our predecessors and those that are still to come. So that's always ongoing and ever changing. Increase the awareness of our veterans and the participation of veterans in the programs and services that we provide. Of course, be exemplary stewards of our resources. We know resources are tight, and so we try to do more with less, and we've done a great job over the past several years, and we intend to continue to do so. And then develop and sustain our quality workforce. Our human capital is perhaps the most important thing within the agency to affect our mission. And so we really want to train them well. We want to provide them a great work environment, and we want them to really soar, if you will, to meet the goals. At this point, I'll turn it over to Brad Lindsay for Programs and Services, our Deputy Commissioner there.
Thank you, Mike. Good morning, Mr. Chair, committee members. Appreciate you having us here today. So just briefly, I'm probably the old timer. I've been, later this month, I'll have been with the department for 22 years, except for a 6-year stint I did as the Olmsted County Veteran Service Officer and the president of the County Veteran Service Officer Association. I am an Army veteran. I am the first Iraq veteran ever employed by the agency, as I worked for the agency at the time I was called up in January of 2003 to go to Iraq and do my year boots on the ground. Both served in the Army Reserve and the regular Army. So our programs and services division assists Minnesota veterans and their families in attaining both their federal and state benefits that they're entitled to. A big piece of what we do is advocacy on the federal side and ensuring we're connecting. And most of our state programs are kind of a bridge to gap into those federal programs or enhance those federal programs. We seek to administer programs and meet the needs of our eligible veterans, their dependents, and the surviving survivors through the following activities or services. So, Ben, advance, please. My division consists of 3 separate divisions with 3 directors in charge of each section. My Veterans Programs Division consists of the State Veterans Benefits Division, or what is also known as the State Soldiers Assistance Program. It also consists of our Veterans Homelessness Initiative, as well as my state veterans cemeteries, of which you all know there are 3. My second division is the Veterans Education and Employment Division, which consists of our campus representatives that are out helping veterans in the veteran resource centers in the schools across the state and the different regions, as well as our Veterans Preference Officer and our state approving agency, which is contracted with the federal VA to approve training programs and educational programs for the federal GI Bill. Small piece there, the Mdva grants program. Actually, Mike is in charge of the grants manager, but we have a large role in that. One of our major grants is to
Looks like you accidentally muted yourself, Brad. Just started talking about Mike.
Sorry about that. Started talking about what, sir? I'm sorry, I lost my place. So anyway,
starting to talk about Mike and the grants management.
Okay, thank you. Yeah, so we have a small role in that, being that our largest grant is the $1.1 million grant that we send out to the county veteran service officers. And my role in that process is the training and certification of those county service officers according to the statute. We have 95 staff right now in the programs and services division. It goes up some during the summer when we bring in seasonal staff for additional help at our cemeteries. We get pretty busy with the mowing and the weed whacking, as you can imagine. As I said, our Veterans Homeless Initiative is a big area of concern that has been the current governor and the last governor's one of their major goals is ending or bringing veterans homelessness to functional zero. We got serious about that in 2014, which was the same year I became the deputy here at the agency. We hired in a team, actually at the time, just one person, a homeless veteran coordinator, to try to pull together all of the different resources and the different entities that are out there and have a coordinated effort towards the issue of ending veterans homelessness. It's the same year we also created what we call the Homeless Veterans Registry to track those veterans. There was no one tracking, no one following, no one really case managing. Some veterans, other veterans were being tracked and case managed by 3 or 4 different organizations. And really the goal, like I said, was to more coordinate that effort and get a by name list of who those veterans were and track recidivism and eventually our success. As you can see from the map here, Minnesota is made up of 10 continuums of care, which are areas of responsibility determined by the U.S. HUD, Housing and Urban Development. And in Minnesota, as of now, we have ended or reached functional zero in 6 of the 10 continuums of cares throughout the state. So we've had a lot of effort. We've worked really hard. We brought the numbers down quite a bit. In 2010, we were at over 600 homeless veterans in the state by the point in time count that is conducted every January. And as of today, this morning, thanks to our handy homeless veteran registry, I can tell you we're at 309 veterans as of this morning that we have in our registry, and we're actively working to seek and find housing for. And then the chart on the right just kind of shows the efforts that have been tracked on the registry since 2014. Last year being the year that we housed more homeless veterans than any other, 2019. And that is all I have for you, gentlemen. Thank you, Mr. Chair, and I will, oh, I'm sorry, I do have a cemetery slide, forgive me. So as I said, we have 3 cemeteries currently in the state. We have one in Preston, Minnesota, we have one in Little Falls, Minnesota, and we have one in Duluth, Minnesota. This past October, we were notified of the opportunity to receive a grant for a 4th cemetery in Redwood County, Minnesota. The agency has been authorized since 2019 by statute, by session law, to construct the 3 additional cemeteries in the state. As I said, we've achieved and built 2 of those. And now we are commencing the process to put in our final cemetery in Redwood County. We will go through a year-long design planning process, and we will know basically in October what our final grant amount will be and whether the VA agrees with all of it. We don't foresee any issues. Everything is going along fine. Redwood County has been gracious enough to purchase the land parcels where the cemetery will be built, and we are in the process of getting that land transferred through the Department of Administration as we speak. And as we said, hopefully to start construction this fall, and it's usually about a 2-year time frame for completion then. All right. I believe that was my last slide. Yep. I will pass it off to Deputy Commissioner Doug Hughes of the Mdva Healthcare Division. Doug.
Good morning, Chair and members. My name is Douglas Hughes. I've been in my position here for 4.5 years. I'm retired from active duty of over 20 years. I then spent about 10 years in the pharmaceutical business with Latin America, with a couple of different countries. Then went to the federal VA where I worked with home and community-based services, and then finally with the position that I'm in now. So we'll put our attention to the first slide there. The 5 state veterans homes that we have in the state. We have 300 beds in Minneapolis, as well as a 50-bed domiciliary, which is licensed as board and care or housing with services, however you wish to do that. We have a 145-bed facility in Hastings. It's licensed for 200, but it doesn't adequately house 200, so we've changed that to 145. We have a skilled facility in Silver Bay that with 83 beds. We have one in Fergus Falls with 106, and then in Laverne with 85 beds. You can see the approximate number of veterans and eligible spouses that we serve. And also there is an effort with some staff that are leading the veteran suicide prevention for the state. Next slide, please. These are the 5 different homes. I'm assuming that you have been to those homes, and I would like to say thank you for all the asset preservation money that has been available. As you know, there's 3 fairly new buildings on Minneapolis's campus with single bed, single shower. Silver Bay is an old school. We're putting some money into that, into their new HVAC. Laverne finished about 1993, is kind of an old style facility, but still functions very well. Fergus Falls is a beautiful facility out there. They have some privates and some other dual rooms out there. And then in Hastings, that's an old state hospital there that could use either many millions of dollars or a bulldozer and new state money. But that's another story. But I can tell you that all 5 state veterans homes provide extremely high quality care. The 4 skilled facilities are all in the top of their class. And Hastings, especially with the new administrator, Mike Anderson down there, who has a strong mental health and chemical addiction background, has really transformed that program to where we have reduced recidivism in alcohol and drug use tremendously, from around 60 plus veterans who could not maintain sobriety to now about 16. That is incredible for any alcohol drug treatment program. Next slide, please. We have, I just forgot to mention that we have about 1,150 or so employees, and we'll probably get to talk to that when we talk about this thing called COVID that we might have been dealing with in the last few months. But here's the new state veterans home update. As you know, the 3 proposed homes, and I know that Chair Lang is deeply involved in the one in Montevideo, and but that's one of the new proposed. Bemidji and Preston, as you can see in the second paragraph on the slide there, the amount of beds that are in those facilities. We've designed those buildings, we think, that would be state of the art. Even with COVID now, we still believe those are the correct design, even though a lot of facilities now will be redesigned in various ways. We believe that the way that those are currently set up, should we ever find ourselves in another pandemic, that those facilities would be more than adequate to handle that situation. Unfortunately, so far those grants have from the state, from the federal VA construction program have not come forth. We're hoping for those funds to come through in 2021, maybe about the time that the pandemic ends, because I would be very difficult to manage both at the same time. We would do it, but it would be a little bit challenging. As you can see on the list where they are, and there's a caveat there that you can see. If you're familiar with the ranking system, being in priority group number 1 is good, but there's priority groups 1 to either 7 or 9, and new homes are group 1.7. As you probably heard, there's been a lot of state veterans homes in the country that have been in trouble with COVID. I believe that my older brother sends me an article regularly about the troubles that have been occurred in those facilities. My guess is that unfortunately, or fortunately for them, a lot of those construction dollars will probably go to redesign of those facilities. That's just my honest opinion, and we'll see where we come out in this next year. Next slide. Suicide prevention. That's one of our newer initiatives. The programs and services side had that for a short while, but since suicide prevention is managed by the Minnesota Department of Health and the federal VA, healthcare system, it made only sense for us to manage that program as well. As you can see, there's a lot of different areas that are covered by the suicide program. As I mentioned, the VA has their program, which suicide is preventable. MDH, and there's a lot of small communities that have programs as well. There's the Governor's Challenge, which is actually it's a federal VA program for states to ask for assistance with some funding, some support. We just received boxes of materials that we're going to be handing out here in the near future related to veterans suicide. And as you may know, on average in the state of Minnesota, there are unfortunately about 105 to 115 suicides annually by veterans. And our goal is obviously zero, because every death by suicide is a tragedy. But our goal is to reduce it by 25% in the next couple of years, and then hopefully in the next 10 years bring that down to zero. So next slide. COVID response. I can tell you that the agency, the division has been consumed. There's no other better word to describe it than consumed by COVID. I can tell you that since March of 2020, especially the senior leadership staff that are housed in Building 10 here on the Minneapolis campus, we have worked nearly every single day since March. Every once in a while now we'll get a full Saturday or Sunday off, but that's not usually the case. We're still working at least a few hours every day, regardless, because our facilities are 24/7. So we need to be on that as much as we possibly can. Some of the strategies that have helped us is that it was organized at the beginning by myself and the senior staff that we would act as one agency or one body. So for example, when some facilities were short PPE, we loaned PPE, my screen went off. We loaned PPE from one facility to another. So we made sure that, and no one was short at any time with any PPE or disinfectants or testing equipment. Never was anyone ever short, and we're very proud of that. Right now, unfortunately, we have lost 25 residents to COVID and one staff, unfortunately, here on the Minneapolis campus. I don't think we're done yet with residents. As you know, that's the greatest group that falls to the COVID virus because of other comorbidities that they have, particularly those who have respiratory diabetes or obesity. I mean, there's so many things that I could say about COVID. I could go on for days, but I'll just say a little bit about testing and vaccine. Testing right now, we're doing 2 tests per week right now. I'm going to go get my test probably shortly after this for the second time this week. I don't even flinch anymore by getting something shoved up my nose. I've been negative, thank you so far. But that has been a huge effort, and I can tell you we have spent millions of dollars on testing, and that's just for staff. Most of the resident testing is covered by Medicare or some other insurance benefit, and we do our testing ourselves by our own staff. So that's a cost bared by time of staff. The staff testing is run by a company that has a state contract. And once again, I can say that is millions of dollars. I believe last year it was close to $3.5 million that we spent on testing. I know since the beginning of the fiscal year, we're sitting at about 2.8 million, and we are planning for approximately 2 million from the beginning of the calendar year to the end of the fiscal year, based on the vaccine being available to the public. Even though we're getting vaccinated, those testing requirements are based on county prevalence. Right now, we have vaccinated over 1,000 staff and residents. We are ahead of most CVS and Walgreens efforts. In fact, I know we are because our pharmacist has contacts from previous employment there, so we're doing better than community on vaccines. And that's just for the skilled. Next week, we should be starting with the domiciliary. And then from there, then it'll be other staff who get vaccinated. But right now, we're vaccinating everyone that we possibly can that's in the healthcare division that has direct contact. Side effects have been minimal. I had a sore arm, just as everybody else did. Others have had fatigue, and a few have had nausea. But other than that, we're doing very well on that and looking for an end to the pandemic. And you can see our goal right there. And I can tell you, greater than 70% staff. We have done a pharmaceutical type marketing program. I put that into place similar to programs that I've been involved in. And I can tell you it's been successful. It's one-on-one a lot of times with staff who are on the fence. So we're looking forward to probably even higher numbers there. Next. So that would conclude my portion. Thank you very much for your time.
Thank you, Deputy Commissioner Hughes.
And Mr. Chair.
Oh, go ahead.
Mr. Chair, I was just going to close it out here for us and then stand for questions. With the one comment as it related to bulldozing, we do have a 25-year plan that I'm working on to transform the campus at Hastings. We've been working diligently on that. And at some point when we get that completed, we'd like to present that to the committee and get some thoughts from you as it relates to how we can do better at Hastings, is taking care of the about 140 to 150 veterans that are housed there in a great program, as Doug said. So at this point, I just stand for any questions that that committee might have.
Thank you, Commissioner. I think Senator Uyghur had a hand up. I don't know if you'd like to ask a question now, Senator Uyghur.
Thank you, Mr. Chair. Actually, a slide and the presentation took care of it after I raised my hand regarding vaccines. And I assume we're going to be getting budget request information in due course. So I'm very impressed with the goals that are laid out. The extent you presumably don't have the to address all those goals to 100%. I'm wondering what's the resource request? I'm assuming we'll get that in the future.
I think that one was a little broken up, but I think, yes, we have some budgetary items coming up towards the end of the month, and I'll kind of go over some of our scheduled or our thought processes as far as budget and bills, as we're going to start hearing those later on. But for now, Senator Anderson, you had your hand up? Muted still, Senator Anderson. Bruce, you're still muted.
For Assistant Commissioner Lindsay, who is the coordinator for the Veteran Homeless Division?
It is Paul Williams now, sir.
Okay, thank you very much.
Absolutely.
And then Senator Newton with his hand up.
Thank you, Mr. Chair. I have a question for Mr. Lindsay also, and that has to do with the money that he said is being expended for staff. Where's that money coming from? Is that coming from the governor's COVID budget?
For which staff specifically, sir, I guess?
For
Well,
testing,
generally, I'm sorry, go ahead.
for COVID testing,
Oh, that would be for Deputy Hughes.
Deputy Hughes, okay.
Representative Newton, that money initially comes from our operating budget. And then we are being reimbursed by a variety of CARE Act funds. And I don't have that exact number that with me right now, but it's in the millions that we've received from CARE Act funds. And I can tell you, we are leaving no nickel on the table when it comes to trying to retrieve funds for anything related to COVID.
Thank you. I just want to make sure that that's not in final analysis coming from your bottom line.
No, sir.
Mr. Chair, could I, Commissioner Herc?
You're muted, Commissioner.
All right, I hit the button too many times. Mr. Chair, committee members, I get briefed weekly on where we are as we stand in relationship to both our additional expenses, operating expenses, and also our loss of revenue, which is significant. Due to COVID, we were unable to keep census in our homes at the point where we had historically had it. So that's actually my biggest challenge right now is the loss of revenue as it relates to having those, instead of, in many cases, we had doubled up individuals that could no longer be that way due to COVID. So we've been able to find a lot of federal help and some state help as it relates to the additional expenses. But to this point, I have not received any help or assistance as it relates to loss of revenue. So we'll see how things come out here. We've asked, we've taken that in consideration, I guess, as we put forward our request for the next biennium and so forth. But it continues to be a challenge for us based on the fact that we both have the additional operating expenses and the loss of revenues. Once the immunizations are in place, it's our plan to try to get the census back up to where it was previously. And Doug's working on that plan feverishly along with everything else that he's doing. So that is our plan going forward. Thank you.
Thank you for the presentation. Ben, did you want to introduce yourself prior to moving on to the next presentation? I don't know if you do.
Thank you, Chair Lang. I appreciate it. Good morning, everyone. My name is Ben Johnson. I'm the Legislative Director for the agency. I've been in this position for about 6 years, well, 5.5, and with the agency since 2014. Prior to that, I was a law clerk at an employment law firm, did a graduate of William Mitchell College of Law. Prior to that, I was with the United States Navy for 6 years, did 3 deployments, started my time in the Navy right about the time that my boss, Chief of Staff McElhenney, was coming home from Afghanistan. So I withdrew from the University of Minnesota. September of 2001 was my last semester there, enlisted in December of 2001, and 6 years, 3 deployments. Working for the agency feels like a continuation of that service to our nation, to our state, and to the veterans who I served with, the guys in the Navy that were on the ships with me, and a bunch of buddies from the Armory in Hutchinson, where I graduated from high school. They all went National Guard. I went Navy, but now we're all veterans, and it's great to work for them. So thank you for the time.
Absolutely. Thanks, Ben. So last order of business we have on the calendar for today is the Minnesota Department of Military Affairs. Today we have with us Adjutant General Mankey, Sean Mankey, and Executive Director Don Kerr. I don't know, I think, sir, you're the first one on the list. Otherwise, Don, if you'd like to go first, it's up to you.
Don, why don't you go ahead and introduce yourself, and then I'll introduce myself and we'll go through the briefing.
Thank you, Mr. Chair and members. My name is Don Kerr. I'm the Executive Director of the Department of Military Affairs. So I'm a retired Army colonel. I joined the National Guard in 1979, went on active duty in 1985, came back to the Guard in 1990, retired in 2006 and became a state employee of the agency as a planner. I've been in my current capacity as the Executive Director for 9.5 years now. My primary role is to assist the Adjutant General in operating the state agency component of his enterprise. And I'm the primary liaison with the legislature and the governor's office. And I'll be driving slides today for General Mankey.
Thanks, Mr. Kerr. Chair Lang, fellow committee members, my name is Major General Sean Mankey. I'm fortunate enough to be selected as the 32nd Adjutant General for the great state of Minnesota. And I'm honored and humbled to be leading the 13,300 soldiers and airmen that we have in the Minnesota National Guard. I started out in the active Army in 1991, served a little over 8 years with time in Germany and Fort Hood. And then I transitioned into the Minnesota National Guard. I spent 13 months in Southeast Turkey, Northern Iraq, supporting Operation Provide Comfort when I was in the active Army. And I deployed in support of Kosovo and with Senator Lang in support of Operation Iraqi Freedom. And then I've been, when I got out of the active Army, I was a traditional Guard member for about 7 years, and then I was hired on full-time for the National Guard. And my most recent assignment before becoming the Adjutant General was the Assistant Division Commander of the 34th Infantry Division Mdva. And now I'm fortunate enough to be serving as the 32nd Adjutant General for the state of Minnesota. I thank you for your time this morning, and I thank you for what you do for our soldiers and airmen in the Minnesota National Guard, as well as our veterans. And for those that I've served with, and for those that I continue to serve with, thank you for your service, and thank you for your continued service in the Minnesota State Legislature. Okay, so next slide, please. Okay, so who we are. As I said, roughly 13,300, just over 11,000 Army soldiers, and the rest airmen in the Minnesota National Guard. And we're prepared to respond federally, as well as in our communities and in our state. Next slide. Okay, what we do, bottom line is we want to have a trained and ready force. We train for our federal mission. 85 to 90% of what we do training for our federal mission sets us up for success supporting our state and our communities. And my goal, as was General Jensen's goal, to have a trained and ready force. Okay, next slide. Okay, this is a snapshot of where we are in the state of Minnesota. You can see we're pretty broadly distributed, and these locations depict either an armory, a maintenance facility, whether it's ground maintenance or aviation maintenance, or one of our two air wings, one being the 148th in Duluth and the 133rd Air Wing at the Minneapolis-St. Paul Airport. Okay, next slide, please. Okay, these are what General Jensen had as priorities. As the Adjutant General, these are adjusting slightly, but no radical left or right changes. One thing that I'm adding an emphasis on is modernization. You may have heard General McConville, the Chief of Staff of the Army, state that the Army's priority will change from readiness to modernization as we move forward, because we have to modernize. We want to make sure that the Minnesota Army National Guard is set up to be part of that modernization, and we believe that we will be part of that modernization. Also on the air side, we have some of the newest F-16s in the inventory, but we want to make sure that we position the 148th for consideration for the future Joint Strike Force fighter, as well as the 133rd to modernize either their existing H models or hopefully get J models so that they're relevant for the fight. I think if you'd ask any airman or soldier, they want the most modern equipment so that they can train on it and execute it, and that they feel relevant in the federal mission. Okay. Okay, people first. This continues on from what General Jensen had, but simply stated, people are our most important resource. And I believe you need to treat people with dignity and respect. One of the reasons the Minnesota National Guard is known across the nation and globally is because of the success of the units that we have, whether it's the 34th Infantry Division, the 1st Armored Brigade Combat Team, the 34th Expeditionary Combat Aviation Brigade, the 133rd Air Wing, the 148th, or the 34th MP Company, whatever it is, we are known as quality soldiers and airmen. One of the reasons we do that is because we are able to fill our formations up to over 100%, both on the Army and the air side. And that is probably the thing that allows us to do what we do. And we must continue to do that to be successful, in my opinion. I think it's about treating people with dignity and respect, being inclusive. I mean, the bottom line, we want to be a representation of the Minnesota National Guard wants to be a representation of the communities that we serve in. So continue to focus on diversity and inclusion of these people. Really, my goal is to make soldiers feel, soldiers and airmen have pride in what they're doing and feel good about what their units are doing, so they want to continue to serve and fulfill their career. Okay, leader development. This kind of goes into people first, making sure that we have our soldiers and airmen trained so that they can lead and that they can do their mission effectively. With the modernization, there will be new skill sets that will be learned so that they are relevant as we continue on down the future. Next slide, please. Okay, organizational safety and security. Doing it safety, being prudent of our resources. This summer, we deployed the first armored brigade combat team to the National Training Center. This was the first brigade combat team rotation since really the COVID pandemic hit, and we did it safely. We didn't lose any lives. We had some injuries, but we mitigated the risks through some of the stuff we did through the COVID mitigation, through testing and COVID mitigation, as well as when we mobilized over 7,000 soldiers and airmen in response to the death of George Floyd's civil unrest. We didn't have any significant safety issues and any significant issues. Take it seriously, go from there. Additionally, we have the 177 Cyber Protection Team that is deployed to Fort Meade, defending the cyber security of our nation in a federal Title 10 mission right now. Okay, fiscal property and responsibility. We want to be prudent with the resources that we have, whether it's flying hours, ground op tempo, and of course the money that we get from the state. So when we ask for something with the state, we believe that we think it up. We put lots of thought into it, planning into it, and present it in bonding. A lot of the money that we get from the state that we use to remodel our facilities and upgrade our facilities, as well as the work we've done at Camp Ripley, is used by other agencies within the state, whether it be our armories as community centers. Some of the stuff we've done at Camp Ripley also benefits the Minneapolis State Patrol or the Minnesota State Patrol, the Department of Natural Resources, as well as the Department of Transportation and other state agencies that train at Camp Ripley. Next slide, please. Okay, communicate and partner. This is a continued emphasis that we have. You know, I've committed and I've talked with Commissioner Herkey, my team, and his team. We believe that we can partner together to create some efficiencies and make things better for some of our soldiers and airmen transitioning to the veterans. We believe that we can use some of the facilities or some of the resources in the veterans organization to improve the care and support that we give to our soldiers and airmen, that people first strategy. We also partner, as you know, with the Minnesota State Patrol, the Department of Natural Resources, and other state interagencies, as well as we partner with different community ethnic agencies to improve our diversity and improve our inclusion. So we work with Kerr in the Asian Pacific Islander community. We work with the JCRC, who helps us partner with other agencies. We partner with LGBT organizations, and we partner with different community organizations to improve our diversity and hopefully make some of our soldiers and airmen feel that we value their lives and what they do in their community, because we take a lot and ask them to give a lot to our organization. At the national level, we partner with, through Align for Training, relationships within the 34th Infantry Division and some of the other organizations we have in the state, across the state to other states, as well as we have the longest running military exchange program with Norway, the Norwegian Exchange, which we have not been able to do the last couple of years because of the pandemic. But we are still in conversation with Norway, and we hope to be able to do that in the next year. And then this year we'll be celebrating our 25th year anniversary of the state partnership program with Croatia. Next slide, please. I'm going to talk a little bit about our response to COVID-19. So we started with, under General Jensen, we started with planning, supporting the State Emergency Operations Center, as well as helping organize some of the warehousing operations to facilitate the deployment of personal protective equipment to some of the different locations within the state. Then we transitioned to support community-based testing sites, which we're still doing today. And most recently, we started supporting care and long-term care facilities throughout the state of Minnesota. Right now, we are doing some planning work with Minnesota Department of Health and the State Emergency Operations Center as the state gets ready to roll out the next phase of the vaccine. And we're not sure what our role will be in that, but we are prepared to support that the best that we can with our soldiers and airmen. Next slide, please. So when we were with, you probably heard me say this, but I don't think any soldier or airman raised their hand to join the Minnesota National Guard and said that they would be, thought that they would be performing care in long-term care facilities. But the fact of the matter is, the local people in some of these communities that provide the care in these facilities were infected with COVID, and there wasn't a lot of other resources. So we were asked to do this. And when we did this, we deliberately did it for the safety of our soldiers and the safety of the residents in these long-term care facilities. So we gave them training, some online training, hands-on training up at Camp Ripley. We tested them to make sure that our soldiers and airmen didn't have COVID-19 before we sent them into these facilities. And we spent extensive time ensuring that they knew how to wear the proper protective equipment to protect themselves and to protect the patients and residents in these facilities. So we've been in multiple long-term care facilities providing this. The good news is that the demand signal that we're seeing on this is trending in the right direction. And there has been less of a demand for us, and we anticipate that we will be able to let some of the soldiers that are on that are now on federal 502F for this mission go in the near future. Okay, next slide, please. Okay, other stuff that we do in support of the state. It seems like every year the Red River or the North floods. This 2020 was no different. We were up in Oslo, Minnesota, doing flood support for the city of Oslo, as well as countless winter storm responses in 2020, whether it be opening up an armory for motorists who are stranded or rescuing them with some of our equipment to get them off of the interstate or off of the highway into an armory. Next slide, please. Okay, civil service response. I mentioned this earlier, but we had over 7,000 soldiers and airmen on state active duty in response to the civil disturbance, which was triggered from the death of George Floyd, the end of May and into early June. Our soldiers performed very well. And as I said earlier, we didn't have any injuries or any significant issues with any of our soldiers and airmen. Protecting critical infrastructure and providing security to the citizens of Minnesota. Next slide, please. Okay, as I said, more than 7,000 soldiers. We provided security at some of the local hospitals. We provided security to first responders, ambulance drivers, and ambulances and fire departments as they responded to scenes, as well as protecting critical infrastructure in the city of Minneapolis, city of St. Paul, and some of our other places, as well as supporting the Minnesota State Patrol and other local law enforcement agencies. Next slide, please. Okay, these next slides are slides that are taken directly from our annual report, which is on the way to the printer as we speak. So you will get a copy of this annual report probably by the end of January. So some of these things that are written are taken out, but in regards to all the work that we do in the state, we still support the federal mission. So in late October, early November, the 34th Expeditionary Combat Aviation Brigade returned from a deployment where they were in Kuwait, Iraq, Syria. They came back. They were extremely busy, did extremely well. Right now, we've got the 177 Cyber Protection Team at Fort Meade doing work support of the National Cyber Defense Plan. We've got the 34th Military Police Company down at Guantanamo Bay providing detention support in a Title 10 mission. And we have two of the 135 Task Force Bayonet in the Horn of Africa doing work for us in a Title 10 mission in support of the National Defense Strategy over there. So along with all the stuff that we do in the state, we continue to train for our federal mission and execute our federal mission, which is where most of our training resources come from. Okay, next slide, please. To your left, the 148th mobilized a significant number of people in support of state active duty in late May and early June, as well as conducted flyovers in support of the critical care workers supporting the COVID fight earlier this summer. The 133rd, our tactical airlift wing, they move equipment. They have moved equipment from our medical supply warehouse in Camp Ripley across the nation in support of hurricanes and other areas where we need to move medical supplies quickly and efficiently. They moved critical equipment in late May and early June to get stuff here so that it was here for local law enforcement. We have been busy in 2020 and we rely heavily on our Air Guard forces as well as our Army Guard forces. Next slide, please. Again, Chair Lang, appreciate your time this morning. Thank all of you for your service to our state in this role, and thank those of you that have served in one capacity or another for your service to our nation in the military role. Pending your questions, that's all that I have formally to present to you today.
Thank you, General Mankey. We don't have any specific, any additional agenda items. I would ask if there's any questions. Senator Howell, I think you had one.
Thank you. And General Mankey, good to have you here today. One question I do have is, where has the funding come from for the care facility staffing? Is that federal or state dollars?
So right now, Senator Howell, it is in 502F. So that is, they are in a federal, it's a Title 32, but federally funded order right now for that. Originally, when we mobilized them, it was on state active duty. So that would have been borne by the state. However, we believe if as past practice, we anticipate 75% of that funding will be reimbursed when it's applied for to FEMA, which has been past practice. But to answer your question, we were on state active duty until we got approval for 502F.
Any other questions? I don't see any hands raised, so I would.
Could I ask you a question?
Senator Uyghur, go ahead.
Yes, thanks, Mr. Chair. I'm sure all of us, as we watched yesterday on TV, the nation's capital under siege, I thought of the Guard. And I'm sure they're reevaluating in Washington what was done. Are we prepared in Minnesota if there was a siege?
Senator, I can tell you I was on a call last night with Colonel Langer, Commissioner Harrington, and the governor, and we looked at what was going on in Minnesota. And the bottom line up front, based on the situation here, we did not believe the Minnesota National Guard was needed. So we did not mobilize any of the National Guard, and I'm happy to say that because this summer we did mobilize the National Guard many times. And some of those times simply we had soldiers and airmen sitting at a staging area ready to go. But the good news is they weren't needed, but we never know. So we have, to answer your question bluntly, we have soldiers and airmen that are prepared to come in on short notice to support local law enforcement or to support the state. The good news is we didn't need them last night, and I'm in touch daily with Commissioner Harrington and other leaders in the state, and we assess that on a daily status if stuff is needed or not needed. The good news is, you know, we are generally the last ones in and the first ones out. So unless we're really needed, oftentimes we're not mobilized. Which we think is a good thing because most of our soldiers and airmen have other jobs, other careers, and if we continuously mobilize them, we're going to burn that relationship with the employer and the soldier or airman. But I hope that answers your question. If not, please fire again. Over.
Thank you.
Senator Lang, I don't have a question in particular, but I would love an opportunity to share a comment or two if that's appropriate.
Go ahead.
Thank you very much. My first meeting with the Veterans Committee, I wasn't disappointed. I'm very happy to be here. Thanks for those who shared earlier and all that you're doing for our veterans across the state. But in particular, I wanted to spend some time just giving some brief comments regarding the Guard as a member. It was a very, very busy year for the Minnesota Army National Guard, and I could not be any more proud to be a member. The things that they were able to accomplish, to do, and also complete an NTC rotation in the midst of all of it, I think was not only very impressive, but also shined a spotlight on the Guard in terms of our state realizing just how important and critical of an asset it really is, and what the citizen soldiers can do for our state in times of need. So General Mankey, thank you and your team for your leadership and everything that you've done and accomplished, and for everything that you currently are accomplishing and that we know you'll be asked to do in the future. Just very, very proud and humbled. Thank you.
Thank you, Senator Duckworth.
Well, again, with nothing else on the agenda, I would just like to kind of reiterate what Senator Duckworth had said. You know, I think we have both departments, both agency heads, General Mankey, yourself included, the members of the committee with Senator Newton as lead, and Senator Howell, Senator Duckworth, Senator Anderson, Senator Kerr, and Senator Uyghur. I think we have a very well-rounded team. I think we have a lot of experience and a lot of different avenues in which we reach that experience level. I'm glad that we have the amount of veterans on the committee that we do. I think it's we're probably going to have a pretty good year when it comes to the Veterans Administration and the Department of Military Affairs. I would like to thank you all again for coming today. I think doing introductions and doing the really easy stuff at the beginning of the year tends to put a good light on the rest of the year, lets us all know where we're coming from. I would like to do a couple of house cleaning things here as we get along. So to the members on the committee, I would ask you all, when it comes to dropping bills and it comes to the hearings, how we're going to schedule those hearings, do it as soon as possible. I know bill processing, and as those bills are processed, a lot of those people are working from home. It's going to be slower. It's going to be more time consuming. So what we're planning, and this is tentative, so don't hold me to it, but the 21st or the 28th is probably going to when we start hearing bills. I would ask that as soon as possible, you know, the best math that I can do is that I assume, again, don't hold me to it, but the first deadline probably in that second week of March timeframe, with the governor's recommendations, I assume coming out at the end of January sometime, last week in January. So we'll have a good idea of where we're going to be. I'm going to start trying to put an omnibus bill around the second week of March. Agency briefings, I assume you're probably going to be the week or two prior to that. With that, I guess I'll open it up to questions once again. If there's anybody that's curious about timeframes or bills, please go ahead and ask now. Awesome. Did I confuse everybody thoroughly?
Okay.
So anyways, that's a rough timeline, what we're looking at. Again, bills as soon as possible, and let me know if there's anything that you'd like the committee to hear prior to it. With that, again, a big thank you to all the agency heads and General Mankey for showing up this morning. This is an odd way to do a committee hearing, but I appreciate all the effort. And with that, I think I'm going to say we will stand adjourned for the day. So thank you, gentlemen. And I think it's all gentlemen. No, Megan and Joan are on, so thank you as well.
Thank you. Well done.